Thank you. James Davis.
Thank you, Secretary of State. I was pleased to hear you refer earlier to long COVID syndrome and what you're doing to tackle that. There was a paper in the BMJ recently suggesting that up to 10% of those infected, possibly 60,000 in this country, have the condition.
Yeah.
And you referred to the long COVID clinics that are being set up.
Yeah.
Could you give some idea of the number of those across the country, the level of access to them, and how we're going to make sure that professionals, particularly in primary care, are aware of their existence?
Well, this is a project in England, and I've had discussions with my colleagues in devolved nations about it, but this is an area of responsibility that's devolved. The short answer is they're rolling out. And we need to get them rolled out as fast as possible. At the same time, as I said to Dr. Evans, we've been communicating with GPs and other primary care professionals to be able to, with the latest insight into how to support people. But unfortunately, there isn't a treatment.
No. It's a good opportunity to highlight the fact that many in the ME, chronic fatigue syndrome community, feel that access to services isn't always what it should be, and I wonder whether this might form a template for improved facilities for them too.
Well, I'll take that point away. It seems very sensible.
Okay, thank you. The Chair was discussing with you provision of urgent care cancer services in particular.
Yeah.
I have a question about routine and elective provision, because clearly the longer that is delayed, the more people suffer, but also the system begins to break down in terms of attendances at A&E unnecessarily and so forth. So what is your assessment as to the provision of those services currently, outpatient appointments and elective surgery?
So if we take the two in turn, in terms of elective surgery, in England, the standard of treatment for elective surgery is the goal is to reach 95% of normal over the autumn. And in many areas we've basically nearly got back to normal, but of course that's really hard because of the need for infection control. And in those areas where there's aerosol generating procedures, obviously it's yet harder. And using testing to give people confidence that they are safe. And the recent updates to infection control advice that went out at the start of this month will help to get back and get those elective rates back. And then when it comes to outpatients, there's a good side and a bad side. The good side is there's been a radical switch of outpatient appointments to telemedicine, which has been a very good thing, and actually increased access in many ways. But there's also, obviously, it's been harder to deliver face-to-face appointments, but that is coming back now as well. So on outpatients, because you can use telemedicine which is much better for the patient and much better for the clinician, where it's clinically appropriate, actually that's been able to take a lot of the strain. The surgery is much more challenging because obviously you can't replace surgery with telemedicine.
Yeah, indeed. And final question from me relates to the uptick in infections more recently.
Yeah.
Many people concerned, are we heading towards a full lockdown again? What does it mean for Christmas? What would you say to people who are worried about the direction of travel?
Well, I'd say that it is for all of us to take this very seriously indeed. And we've seen in other countries that if you don't take a second spike seriously, then it can lead to very serious problems down the track. Now, I want us, if at all possible, to get to a position where we can all have the sort of Christmas that people yearn for. But that will require everybody to play their part, to follow the social distancing, to follow basic hygiene. The hands, face, space concept has been developed as an easy way to remember the three single most important things that individual people can do.
Thank you.
Thank you very much.